the role of, say, clinical placements.
Mm-hmm.
And the thing that I really struggled with was a lot of the clinicians were not that interested in being a supervisor. And so their feedback was, you didn't do what I would do, so you're wrong.
Mm-hmm.
How do you think, and this goes back a long way, because if you look at the history of medicine even, it was, and particularly especially if you look at, say, surgery, it was by apprenticeship. We've used a similar model in the teaching of physiotherapy. It works to a certain extent, and there's obviously issues with it, which we don't need to get into. But do you think that overhang creates some of this stuff that you're talking about?
100%.
Yeah.
Because we're stuck on this, what they call untrustable professional activity. Yeah. And can you do this, yes or no? I mean, that's a tick or, fail or not fail, instead of can you actually, it goes back to probably our very first comments, really. We're talking about being outcome focused, not input focused. And so can you actually treat a patient and get an outcome that's what I would call significant outcome. So significant meaning the patient feels like an improvement and you can measure a change in their function. To me, that's what we should be looking at. And early in a career or a program, we need to look at perhaps can you be able to manipulate a joint? Can you do that safely and effectively? Can you prescribe an exercise safely and with some level of accuracy, but can you now manipulate it and produce an outcome? And I think what we've got is this Untrustable professional, almost like, as you say, an apprenticeship. Can you do this? Yes, no, which means it's very boring as a supervisor. Can the patient do this? Yeah. Well, can the student do this? We have students that are chasing that yes or no, not chasing the ability to grow and be able to feel that they can do those little experiments, the one-off experiments, and see what's going on. And I think that's something at the end of a training program, more so probably in the postgraduate level, but in that early stage, towards the end, they should be able to do that. They should be able to, and one of the stories that always sticks in my mind was there was a fourth-year student at one of the previous universities that I worked at. And this person came in and had in-range cervical pain, so right in-range, right rotation, say, for example. And they'd been doing grade 4 in a neutral position. And I said, why don't we just try and put them into right rotation as far as they can go and mobilise them again? But you might have to just treat resistance, so just touch on it and you might be grade 3 again, but give it a go and see how you go. Anyway, they cleared full rotation. And they said, where did you learn that trick? And it saddened me. I went, oh, dear, because they were looking for a trick. They hadn't learned that trick. And I thought, hang on, this goes back to your question. Here's the supposed science of what a facet joint does. Here's the connective tissue sciences. This is what we did. Now, none of them individually may not be perfect. We may not know the full answer, but together they have an outcome.
I think